Good morning. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. This is Journal Watch from Open Med School. Uncertainty exists whether lowering systolic blood pressure to less than 120 millimeters of mercury is superior to that of less than 140 millimeters of mercury, particularly in patients with diabetes and patients with previous stroke. So, this is the matter, and the study came in Lancet in July 2024. Lowering of systolic blood pressure to less than 120 versus less than 140 millimeters of mercury in patients with a high cardiovascular risk with and without diabetes or previous stroke. An open label blinded outcome randomized trial. So this is the title of the article. We all know that hypertension increases the risk of cardiovascular diseases. The relationship between high systolic blood pressure and cardiovascular risk is well known. Previous trials like SPRINT showed benefits of intensive BP control, but uncertainty persists, especially in case of patients with diabetes and stroke. So, the investigative objective was, if lowering BP to less than 120 millimeters of systolic is superior to less than 140 millimeters of mercury in high cardiovascular risk patients. Assess effects in subgroups, especially those with diabetes and stroke. So these are patients who are having diabetes and stroke with or without it. The study design is an open label, blinded, randomized control trial. 116 hospitals in China, more than 11,000 patients with a cardiovascular risk, mean age was 64.6. There is two groups. The intensive group, the target of blood pressure was 120. In the standard group, target was systolic BP less than 140. The median follow-up time was 3.4 years. What was the primary outcome they looked? The composite of myocardial infarction, revascularization, heart failure, stroke, or cardiovascular death. These were the primary outcomes. Total, as already mentioned, more than 11,000 patients. 4,359 had diabetes, more than 3,000 had history of stroke also. Mean age, as mentioned, 64.6 years. The cases were randomized for balanced baseline characteristics. The results. The intensive group, the mean systolic BP was 119.1, and in the standard or conventional group, it was systolic BP 134.8. The follow-up duration was 3.4 years. The results, the primary outcome, the events which already mentioned, like myocardial infarction and stroke and hospitalization or heart failure. In the intensive group, it was 547, that is 9.7%, and in the standard group, it was 11.1%, and statistically significant p-value 0.028. Conclusion: lowering systolic BP to less than 120 millimeters of mercury reduced major cardiovascular events as per this trial. In the subgroup analysis, it was found that no significant difference in treatment effects based on diabetes, duration of diabetes, or history of stroke. Whether patient had diabetes, whether patient had stroke, irrespective of that, there is no difference. So what were the major adverse events? Synco was more frequent in intensive group, 0.4%, where in standard group it was 0.1%. No significant difference between groups in hypertension, electric imbalance, falls, or acute kidney injury. What is the interpretation? The intensive treatment aiming for systolic BP less than 120 millimeters of mercury prevents major cardiovascular events with a minor increased risk of syncope. Clinical implication. It supports more aggressive BP control in high-risk patients, including those with diabetes or stroke history. That is, we may practice this in our clinical. Even in patients with stroke and diabetes, with and without it, lowering BP is found to be beneficial. What are the limitations? It's a short follow-up period for a long-term outcomes. Study population was predominantly Chinese, which may limit the generalizability. Is an open-label design. There is no conflict of interest. The funding source was Ministry of Science and Technology of China. So, in conclusion, lowering BP to less than 120 millimeters mercury provides cardiovascular benefits in high-risk patients. So, this is the article. Hope it was useful to you. Thank you.